Hello friends, today I am going to discuss about the management of ovarian hyperstimulation syndrome, Green-top Guideline number 5 summary. Now the executive summary of recommendations. The incidence of ovarian hyperstimulation syndrome. What is the reported incidence of ovarian hyperstimulation syndrome? Clinician must remain alert to the possibility of ovarian hyperstimulation syndrome in all women undergoing fertility treatment, and women should be counseled accordingly. Diagnosis of ovarian hyperstimulation syndrome. How is ovarian hyperstimulation syndrome diagnosed and what differential diagnosis should be considered? Clinicians need to be aware of the symptoms and signs of ovarian hyperstimulation syndrome, as the diagnosis is based on clinical criteria. In women presenting with the severe abdominal pain or pyrexia, extra care should be taken to rule out other causes of the patient's symptoms. The input of clinician experienced in the management of ovarian hyperstimulation syndrome should be obtained in such cases. Assessing severity and reporting adverse outcomes. How is the severity of ovarian hyperstimulation syndrome classified? The severity of ovarian hyperstimulation syndrome should be graded according to a standardized classification scheme. Now, how should ovarian hyperstimulation syndrome be reported? Licensed centers should comply with Human Fertilization and Embryology Authority regulations in reporting cases of severe or critical ovarian hyperstimulation syndrome among their patients. Units that treat women with ovarian hyperstimulation syndrome should inform the licensed center where the fertility treatment was carried out to promote clinical continuity and to allow the licensed center to meet its legal obligations. Organization of services. How should care be delivered for women at risk of ovarian hyperstimulation syndrome? Fertility clinics should provide verbal and written information concerning ovarian hyperstimulation syndrome to all women undergoing fertility treatment, including a 24 hours contact telephone number. All acute units where women with suspected ovarian hyperstimulation syndrome are likely to be present should establish agreed local protocols for the assessment and management of these women and ensure they have access to appropriately skilled clinicians with experience in the management of this condition. Licensed centers that provide fertility treatment should ensure close liaison and coordination with acute units where their patients may present. Initial assessment. How should women suspected of suffering from ovarian hyperstimulation syndrome be assessed? Women presenting with symptoms suggestive of ovarian hyperstimulation syndrome should be assessed face to face by a clinician if there is any doubt about the diagnosis or if the severity is likely to be greater than mild. Outpatient management of ovarian hyperstimulation syndrome. Which patients with ovarian hyperstimulation syndromes are suitable for outpatient care? Outpatient management is appropriate for women with mild or moderate ovarian hyperstimulation syndrome and in selected cases with severe ovarian hyperstimulation syndrome. What management is appropriate in the outpatient setting for patients with ovarian hyperstimulation syndrome? Women undergoing outpatient management of ovarian hyperstimulation syndrome should be appropriately counseled and provided with information regarding fluid intake and output monitoring. In addition, they should be provided with contact details to access advice. Non-steroidal anti-inflammatory agents should be avoided as they may compromise renal function. Women with severe ovarian hyperstimulation syndrome being managed on an outpatient basis should receive thromboprophylaxis with low molecular weight heparin. The duration of treatment should be individualized, taking into account risk factors and whether or not conception occurs. Paracentesis of acidic fluid may be carried out on an outpatient basis by the abdominal or transvaginal route under ultrasound guidance. There is insufficient evidence to support the use of gonadotropin releasing hormone antagonists or dopamine agonists in treating established ovarian hyperstimulation syndrome. How should women with ovarian hyperstimulation syndrome managed on an outpatient basis be monitored? Women with ovarian hyperstimulation syndrome being managed on an outpatient basis should be reviewed urgently if they develop symptoms and signs of worsening ovarian hyperstimulation syndrome. For more details, see section 9.3. In the absence of these, review every 2 to 3 days is likely to be adequate. Baseline laboratory investigations should be repeated if the severity of ovarian hyperstimulation syndrome is thought to be worsening. Hematocrit is a useful guide to the degree of intravascular volume depletion. Inpatient management. When should women with ovarian hyperstimulation syndrome be admitted? Hospital admission should be considered for women who are unable to achieve satisfactory pain control, are unable to maintain adequate fluid intake due to nausea, show signs of worsening ovarian hyperstimulation syndrome despite outpatient intervention, are unable to attend for regular outpatient follow-up, have critical ovarian hyperstimulation syndrome. Who should provide care to the woman with ovarian hyperstimulation syndrome? Multidisciplinary assistance should be sought for the care of women with critical ovarian hyperstimulation syndrome and severe ovarian hyperstimulation syndrome who have persistent hemoconcentration and dehydration. Features of critical ovarian hyperstimulation syndrome should prompt consideration of the need for intensive care. A clinician experienced in the management of ovarian hyperstimulation syndrome should remain in overall charge of the woman's care. How should women with ovarian hyperstimulation syndrome be monitored? Women admitted with ovarian hyperstimulation syndrome should be assessed at least once daily. More frequent assessment is appropriate for women with critical ovarian hyperstimulation syndrome and those with complications. How should the symptoms of ovarian hyperstimulation syndrome be relieved? Analgesia and antiemetic may be used in women with ovarian hyperstimulation syndrome, avoiding non-steroidal agents and medicines contraindicated in pregnancy. What is the appropriate treatment of fluid balance? Fluid replacement by oral route guided by thirst is the most physiological approach to correcting intravascular dehydration. Women with persistent hemoconcentration despite volume replacement with intravenous colloids may need invasive monitoring, and this should be managed with anesthetic input. Diuretics should be avoided as they further deplete intravascular volume, but they may have a role in a multidisciplinary setting if oliguria persists despite adequate fluid replacement and drainage of ascites. How should ascites and effusion be managed? Indication for paracentesis includes the following: severe abdominal distension and abdominal pain secondary to ascites, shortness of breath and respiratory compromise secondary to ascites, and increased intra-abdominal pressure. Oliguria despite adequate volume replacement secondary to increased abdominal pressure causing reduced renal perfusion. Now, paracentesis should be carried out under ultrasound guidance and can be performed abdominally or vaginally. Intravenous colloid therapy should be considered for women who have large volume of fluid removed by paracentesis. How should the risk of thrombosis be managed? Women with severe or critical ovarian hyperstimulation syndrome and those admitted with ovarian hyperstimulation syndrome should receive low molecular weight heparin prophylaxis. The duration of low molecular weight heparin prophylaxis should be individualized according to patient risk factors and outcome of treatment. Women with moderate ovarian hyperstimulation syndrome should be evaluated for predisposing risk factors for thrombosis and prescribed either antiembolism stockings or low molecular weight heparin if indicated. In addition to the usual symptoms and signs of venous thromboembolism, Thromboembolism should be suspected in women with ovarian hyperstimulation syndrome who presents with unusual neurological symptoms, even if they present several weeks after apparent improvement in ovarian hyperstimulation syndrome. When is surgical management indicated? Surgery is only indicated in patients with ovarian hyperstimulation syndrome if there is a coincident problem such as adnexal torsion, ovarian rupture, or ectopic pregnancy and should be performed by an experienced surgeon. Ovarian hyperstimulation syndrome and pregnancy. What are the risks associated with pregnancy and ovarian hyperstimulation syndrome? Clinicians should be aware and women informed that pregnancies complicated by ovarian hyperstimulation syndrome may be at increased risk of preeclampsia and preterm delivery. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.